Grand Rapids is a city located in Kent County in the southwestern corner of the state of Michigan. It has a population of around 65,000 individuals, with around 85% of them being white. The area has high graduation rates at around 89.5% from high school, and low poverty and unemployment rates on comparison to the national averages. Some of the issues we see in this area include high smoking rates in teens, around 15%, which is around twice that of the national average. Concerns about water quality with their proximity to the city of Flint and their recent issues, as well as concerns over emergency preparedness for issues such as tornadoes on the part of not only the community members, but emergency response teams as well. A recent study in the area showed that many residents are concerned about their access to health care. Stats show that around 10 to every 10,000 people, there are just over 100 care providers, which is not a very high rate for the area. Unfortunately, they're spread pretty thin in terms of primary care providers per individual in the community. Some of the other issues that we see are not as prevalent in the minds of the residents, that being that of the opioid crisis. It's not necessarily in the minds of many individuals, but it's a pretty prevalent issue in the area, specifically with it being in the Midwest is where we see some of the bigger problems, as well as rural areas. We're choosing this issue because there's a pretty strong base of intervention already in play in the area that we can really build off of. And with recent developments in the government, it's a pretty opportune time to really act on this issue. Around 63,000 people died of a drug overdose in 2016. 66% of those were due to opioids, whether that be prescription opioids, synthetic opioids like fentanyl or its various analogs, or heroin. Again, those are the three main categories of opioids that we really see being an issue. Prescription drugs being those, anything containing methadone, so OxyContin, which is no longer made, but is really the drug that kind of started a lot of this. Things like Vicodin, Percocet, anything that's really prescribed for possibly post-surgery or chronic pain type of issues. A lot of lower back pain, we really see that being, at least previously, not so much now, being prescribed for issues such as that. Synthetic opioids like fentanyl were originally formulated and prescribed for individuals who are suffering from cancer. This was really prescribed in the latest stages of their life to deal with that end-of-life pain. Some analogs such as that, like carfentanil, have been pretty popular street drugs and are really kind of the center of the issues that we're looking at right now. Some of those analogs can be around 10,000 times more potent than morphine and are typically used as tranquilizers for large game animals, so really not for human consumption at all. The third category would include heroin, which is one of the illegal types. Obviously, that's one that we really see on the streets. Typically, people will turn to heroin after being hooked on prescription opioids. Suffering from an addiction to prescription opioids is typically one of the top risk factors for then turning to intravenous drug use, such as heroin, crack, things of that nature, which can also lead to other issues in development of certain diseases such as hepatitis C, HIV, and possibly AIDS. We really saw this epidemic kicking off in kind of the 1980s with the development of OxyContin and other opioid drugs to be used in a prescription form. They were originally formulated to be released on a slower schedule, so to be released in the body over around 12 to 18 hours as opposed to 6 hours as morphine was. Most researchers and drug developers at the time believed that this led to it being non-addictive and non-dependency forming because it didn't release as quickly. It didn't give you necessarily a high that drugs like morphine did. So with that being the status in the industry, it was prescribed incredibly heavily. One of the reasons being that around the same time, pain was added as the fifth vital sign for anyone who comes into a hospital, if you're in the emergency room, whatever that may be, when they're collecting all of your vital signs, blood pressure, your heart rate, anything of that like that, pain was the fifth one. So you go into the hospital, they ask you what's your pain on a scale of 1 to 10. They're really aiming at just improving patient satisfaction and patient pain management. But with that all happening kind of at the same time, we really saw it being a kind of flashpoint for this epidemic. By the time that they really started to realize that these drugs were addictive and were dependency forming around the late 1990s, early 2000s, it was kind of already at a point that was hard to control, as we have obviously seen now in this day and age with the scope of this epidemic and the difficulty that we're having really getting it under control, especially now with the various forms that we're dealing with coming from all across the country and in some cases all across the world. Parts of the government have taken steps to controlling it with prescription drug management programs. Anytime you're prescribed anything, you pick it up at a pharmacy, everything is logged into a computer to keep rates of prescribing. We want to make sure that we're keeping those lower, as well as we're making sure that individuals aren't coming in more frequently than they should be. I'm trying to get a track on false prescriptions that individuals who are suffering from drug abuse may be using to get their hands on more. Also things like drug take-back programs and various other analysis tools that we're using to really monitor the rates of prescribing and the rates at which people are taking these drugs. The intervention that we are really focused on implementing in this community actually is already here. Our main focus is to really expand upon that and get its services to as many people as we possibly can. The Grand Rapids Red Project has been an institution in this community for a couple decades now. They focus on syringe exchange, so individuals who are suffering from drug abuse can get clean needles to stop the spread of disease like hepatitis or HIV, any of those that we typically see from intravenous drug use, trying to really keep those rates down and make sure that until we can get those individuals into treatment, they're staying as safe as they can. Another branch of their project is overdose prevention in the form of training with naloxone, otherwise known as Narcan, which is a nasal spray that can be administered to anyone suffering from a drug overdose that reverses the effect of that overdose, and it saves their lives, essentially. The program has already trained around 1,000 law enforcement officers in the area, but the real focus of our intervention here is to get that training to all law enforcement officers in the city of Grand Rapids, in Kent County itself, even throughout the state, as far as we can really get it. Those are the people that are, kind of the first on the scene, that may just be driving around, even canvassing an area, could see someone that's unresponsive, and to have them be able to not only recognize those signs of a drug overdose, but to administer that life-saving drug and save a person's life is really important and really kind of where we want to focus our efforts. Again, why this intervention? We already have a pretty strong base here with this organization already being here in this community. It really cuts down on the amount of red tape and things of that nature that we would need to implement it in a community that maybe doesn't already have these programs, as well as the government. President Trump has recently signed a bill that has dedicated a large sum of money to fighting this epidemic through various different kinds of treatment, so including some of the medication-assisted treatment programs, which is something that we would be looking to get those individuals that we can hopefully save through this Narcan training eventually into to help them to get over their overdose, as well as research on things like that, and hopefully general funds to make some of these training programs and access to things like Narcan more widely available. Another reason that we're focusing on this is because, as stated by many of the residents in this area, there's a lack of proper immediate health care. There's a pretty heavy burden per provider on the amount of individuals that they're really serving, so at times that can make it hard to really provide a thorough treatment plan in terms of someone who may be suffering from chronic pain, thinking things more like physical therapy or homeopathic methods, as opposed to just, walking in saying, you have this pain, here's a prescription for this medication, and walking out the door. So this is kind of focusing on another branch of that healthcare in terms of obviously preventing these overdoses and then hopefully being able to get them into a treatment program, because the burden on care providers is so heavy right now, trying to maybe move a little bit of that aside. Some other issues that we see really feeding into this, poverty, although the poverty levels in this area are lower than the national averages, it is still there. The misprescribing of them, which again falls under the category of, not necessarily proper access to healthcare or really entirely efficient healthcare that we're looking for, as well as maybe possibly a genetic predisposition. A lot of issues really feed into this problem, but the healthcare aspect is really the one that we want to focus on here. Obviously, we're really looking to partner with the law enforcement organizations in this community. They are our main target. They are the ones that we really want to get into these training programs so that they have the tools to really correct the issues of drug overdose and overdose deaths, as some other organizations are really taking the forefront on getting the prescription rates down. We need to still focus our attention on those who've already fallen victim to addiction and things of that nature, various types of drug abuse, as well as we want to focus on any of our emergency responders, whether it be EMTs, those that work in an emergency room. Obviously, may also be on the forefront of individuals who would really have the first look at someone who may be suffering from a drug overdose. And we really just want to make sure that we can get as many people as we can into these training programs, and we want to be able to reach as many people as we can with these programs, so that anyone who may have any type of relation to someone who's suffering from a drug abuse can have the tools to be able to potentially save their lives one day. And then hopefully after that, maybe get them into treatment, which will be another thing that we're trying to focus on later. But for the time being, this is really where we want to focus our efforts. And we really think that this community has the base to really make it very successful and to hopefully one day stop an end to this horrible epidemic, and just overall have a better, make Grand Rapids, make Kent County a better place for people to live.